Today we will discuss about forensic toxicology and duties of registered medical practitioner in case of suspected poisoning. In forensic toxicology, we will discuss about introduction, about classification of poison, about Act and IPCs related to poison, and what is medico-legal importance of poison. Definition of forensic toxicology. The forensic toxicology defines the medical and legal aspect of the harmful effect of chemical on human beings. And then what is poison? The poison is any substances in form of liquid, solid and gases, which if introduced in the living body or brought into the contact with any part of the body, produce harmful effect or ill health or may cause of death. The act related to the poison, the Poison Act 1919 and the Pharmacy Act 1948 and the Drugs and Cosmetic Act 1940 and the Drugs Control Act and the NDPX Act 1985. The Poison Act 1990 regulate the import, possession and sales of poison, and the NDPS Act related to narcotics, drugs. And then Poison Information Center. This center is provided toxicity assessment and treatment recommendation over the telephone throughout the day for all kind of poison. The National Poison Information Center located in AIIMS, New Delhi. It uses a computer software Intox compiled by WHO, and the National Institute of Occupational Health Center located at Ahmedabad. Then how to prevent poisoning? The education is major component, and all drugs and toxic substances should be labeled and kept in locked cabinet, and all household poison must be kept reach of children. Like kerosene, all out, या other thinner, या other poisonous substance. If any person have suicidal tendencies, proper care and psychotherapy consultation should be must. The workers in all factories should be properly educated regarding poisoning. And then medical legal aspect of poison, the section 85, 86, 274, 275, 276, 277, 278, 284, 324, 326 IPCs are related to poisoning. Section 85 IPCs, the criminal act done under involuntary intoxication means if person is intoxicated without his knowledge and against his will, and then become incapable of judgment and commits a criminal act without know what he was doing, then he will be not responsible for the crime. Example, suppose X administered dhatura poison to Y without his knowledge in mix of liquor or other means, and then Y murders Z under the effect of dhatura, then who will be the responsible? Y? No, X will be the responsible in this case. And section 86 IPC, the criminal act done under voluntary intoxication. The person takes intoxicating drug, voluntary and loses self-control and commit a crime. Important is in this act under voluntary intoxication. उसने जानबूझ के खुद ने अपने आप को इंटॉक्सिकेट किया है by the alcohol या other means, other poison. The person takes intoxicating drug voluntary and loses self-control and commit a crime. Person is taken for medical legal examination and found disoriented about time, place and person. In this case, from a medical legal point of view, he did not know what he was doing, but legally it would be presumed that he know what he was doing. What intention is very important in this case. And section 274, related adulteration of drug. In this section, 6 month punishment. Ideal suicidal poison means should produce an easy death. Very important in case of suicidal. Very important criteria, should produce an easy death. The opium and barbiturates, example sleeping pills, fulfill these criteria. And should be easily available, capable of being easily taken in food or drink. Cheapness is not a criteria in ideal suicidal poison because as a dying man would not worry about the cost. The nature of poisoning. The poisoning may be homicidal, suicidal, parasuicidal, accidental, abortifacient, aphrodisiac, aero poison, and cattle poisoning as estufying agent. The ideal homicide poison means should be colorless, odorless, and tasteless. And this poison should be easily available, should be cheap, and its symptoms should resemble a natural disease. In ideal homicidal poisoning, and some symptoms should appear late after administration to avoid suspicion. Should be highly toxic and should be not produce vomiting. There should be no antidote and no postmortem changes, and should disappear from the body after death. And there should be no test for detection of poison. Then ideal suicidal poison. The ideal suicidal poison should produce an easy death. Very important criteria in ideal suicidal poison. That should produce an easy death. This opium, barbiturate fulfill this criteria, and these suicidal poisons should be easily available, capable of being easily taken in food or drink, and cheapness is not a criteria in ideal suicidal poison. As a dying man would not worry about the cost. And the parasuicide. Parasuicide means the pseudo-suicide and near suicide. Refer to suicide attempts or gestures and self-harm but no actual intention to die. इसमें पेशेंट से नाटक करता है, उसकी मरने की कोई इच्छा नहीं होती, उसको ही knows that radial artery in thumb side but he cuts on other side. And purpose is only threatens relatives by taking and sublethal dose of sleeping pills. उसको पता है कि कितने टैबलेट उसको खानी है जिससे वो मरे नहीं लेकिन रिलेटिव को डरा सके. Also seen in psychologically disturbed person. Mostly this type of parasite seen in psychologically disturbed person. And then accidental poisoning. Accidental poisoning, mistakenly ingestion and excessive self-medication by infected food, and accidental poisoning mostly occur in children, and animal bites, e.g. snake bite and dog bite. Then next, abortifacient poison. Abortifacient poison would cause abortion. Example, aconite, arsenic, calotropis, ergot and mercury. And next, the aphrodisiac poison, substances that increase sexual desire. The arsenic, cannabis, cocaine and opium. The next is arrow poison. The arrow poison are used tip of arrow for hunting and kill of the enemies. Example, aconite and Abrus pectorius, Rati. And the cattle poison used to kill cattle of enemies. The next, stupefying poison used to stupefying travelers for robbery and women for sexual assault. Example is cannabis and datura. Datura also called roadside poison. Then other classification of poison, according to symptom. The corrosive include strong acid, example sulfuric acid and hydrochloric acid, and strong alkalis, sodium hydroxide and potassium hydroxide. The metallic salt, the copper sulfate and ferric chloride. The next class irritants, the non-metallic, the phosphorus, bromine and iodine. And irritants metallic are arsenic, copper, mercury, lead and thallium and zinc. And then other irritant poison in animal poison, snake, scorpion and firearms. Mechanical poison, example is powder glasses. And systemic poison, example CNS poison, CVS poison. CNS poison means cerebral poison. Cerebral poison may be CNS stimulant and CNS depressant. CNS stimulant example amphetamines, caffeine and modafinil, and CNS depressant alcohol, sedative and opioids. The next delirium poison. Delirium poison examples cannabis, cocaine and dhatura. The next is spinal poison. Spinal poison example nux vomica, and cardio poison. Cardio poison example this poisoning effect on CVS system. Example aconite, oleander, quinidine and tobacco. Then how to diagnose in poison? Suppose a young lady brought by the attendant in emergency with history of unknown ingestion of unknown substance, patient in unconscious condition. Then how to diagnose and treat this case, and what is the medico legal duties of medical officer in such cases, in cases of suspected poisoning. Then how to diagnose a poisoning in the living person. In the living person, the proper history is must. Then after proper history, examine clinical sign and then lab investigation. The clinical history is of great importance. There is no single symptom which is characteristic of poisoning. On the basis of single symptom, we cannot say that this is a poison case. The major questions should be asked in poisoning cases about the medication or material ingested and or exposed to, and how much amount ingested by patient. And what is the time of exposure and the history of MSs, did it occur or not, and it occur, then what came out. The reason for poisoning, homicidal, आपको किसी ने पॉइजन दिया है या उसने गलती से लिया है या उसने खुद ने लिया है, तो रीजन फॉर पॉइजनिंग होमिसाइडल, एक्सीडेंटल एंड सुसाइडल. एंड द साइन एंड सिम्टम ऑन द बेसिस ऑफ एग्जामिनेशन. देन फर्स्ट वाइटल्स शुड बी टेकन. व्हाट इज द बीपी, pulse of patient, pulse, saturation, temperature and respiratory rate. Then examine eyes. The meiosis means constriction of pupils. Many poison produce meiosis, and mydriasis and nystagmus. Then come to oral examination. Oral examination is one in case of corrosive, dry mouth, dysphagia, gum lines and salivation. Then next to see in case of poisoning, pulmonary sign. The some poison cause bradycardia. Bradycardia means decrease respiratory rate. Example is antidepressant and opiate. Opiate depress respiratory center. And some cause tachypnea. Tachypnea means fast and rapid respiration. Example is which cause tachypnea is cyanide, carbon monoxide and amphetamine. Then next we will see the CNS sign. CNS sign include ataxia. Ataxia found in alcohol cases and narcotics poisoning. Then coma. Other CNS sign is coma, muscle fasciculation, muscle rigidity. In case of spinal poisoning, strychnine, nux vomica. Paresthesia, peripheral neuropathy. Peripheral neuropathy occurs in chronic lead poisoning, arsenic poisoning and mercury poisoning. And then see skin sign. Skin sign in alopecia in chronic poisoning. It found in arsenic poisoning and mercury poisoning. Then blister and bulle, diaphoresis. Diaphoresis means excessive sweating. And dry hot skin occur in datura poison. And other see on the body, patient body, see injection mark, needle mark in case of drug abuse. If patient has jaundice, it may be due to hepatotoxic poisoning. Then examine urine. Urine may be colored some poison. The urine is colored in some poison, just yellow brown. It may be yellow brown, red brown and black in black color in occur in phenol poisoning. And how to diagnose poisoning in the dead person. Dead person, the poisoning diagnosed by in dead person by the full proper history should be taken from relatives and people present at the time of scene, at the time of crime. Visit to scene and collect proper evidences. And postmortem examination, proper postmortem examination, external appearance, what is external appearance, what is any stain and what is smell, and marks of violence in case of struggle. The internal examination is a smell, mouth, teeth, stomach examination, and content of stomach, what is color, volume, nature, capsule and foreign bodies. And what is the treatment of acute poisoning we will discuss in next classes. Thank you.